mentioned earlier that when someone comes to the emergency room or gets to the hospital, if they've got some evidence that they really are having a heart attack, they might not even go to the emergency room.
Right.
They go to the catheterization lab.
Exactly.
What happens there? What's the catheterization?
Sure.
What is that?
Sure. So cardiac catheterization, cardiac means heart, and catheterization means inserting a small plastic tube into a blood vessel and passing it up into either the heart muscle itself or using it to inject a dye that shows us a picture of the heart blood vessels. It was invented by the fellow who, my original mentor and trainer, Louis Dexter at the Brigham Hospital in Boston, who did the first heart catheterizations. So the procedure, there's many different forms of heart catheterization these days. The one that would be done on somebody that we think is having a heart attack is called coronary angiography. Coronary means the heart blood vessels, and angiography means taking pictures of the heart blood vessels. And so what happens is the catheter, let's say, is passed from the little artery here where you feel your pulse, or from an artery in your groin, up, and it's specially formed, so it goes right into the coronary artery. We inject this dye that looks clear when you and I look at it, but to the X-ray, it looks like milk. It looks white. And we see an X-ray movie, we can actually see, oh, look at that. The artery started here. Oh, it stopped early. It's blocked. So then what they do is they pass a small wire down that artery, and eventually another catheter with a deflated, collapsed balloon, and they open the balloon, and it breaks up the clot and opens the artery. And often they'll put a small metal wire stent in there to hold the artery open at that point. And it's usually a point where the atherosclerotic process, the hardening artery process, has ruptured or in some way torn, so that suddenly the body's clotting mechanism sees, oh, there's an injury here, we have to form a blood clot, just like you get a scab on your skin when you bleed and you stop bleeding.
So in other words, they put the catheter in there, they can take a picture of the blood vessel to the heart, and if one of them is closed, the one that's causing the heart attack, they put the balloon in there and open it up and put in a stent, and that basically can stop a heart attack.
Absolutely. Now, what often happens, of course, is the heart has three main blood vessels. I always tell patients, think of it as you have three lines going from the gas tank in your car and into the motor. So usually, patients have just one vessel that's severely involved, but sometimes we'll see patients with additional very severe, what we call high-grade narrowings elsewhere, and sometimes those will be fixed at the same time, or we'll keep the patient in the hospital for a day or two, bring them back, and do the other blood vessels at a later point. If it's very severe and is difficult to get at with angioplasty, we may send the patient for coronary bypass surgery, where blood vessels are taken either from the back of the breastbone or from the leg and inserted into the heart. Sort of like you're going along the highway, there's a bridge over a river, the bridge is washed out, we build a new bypass highway across and connect up so the traffic can keep going. And that's why it's called coronary bypass. It bypasses the area that's narrowed.
Now, is there anything else about this acute management of heart attack that you should know? Because what we've heard about is that if someone clearly is having a heart attack, they go to the cardiovascular, the catheterization laboratory, and they do this test called an angiogram. And so they open it up with the balloon, and if the balloon can't do the job right, sometimes they might need to take into the operating room and do the bypass.
Absolutely.
Are there other acute management things that would be done instead of that or in addition to that people should know?
Sure. Well, the last 40 years has seen tremendous development of drugs, of pharmacological products that are given at the same time or even before the catheterization that can help to slow down the heart attack to some degree, and also to manage to help keep the stent or ballooned area open. So there's blood thinners. Because people who have a heart attack at that moment have a tendency for the blood to clot in a blood vessel. So we want to interfere with that. And so usually there are some forms that we give intravenously, that is by injection, during the time that the patients are in the catheterization laboratory. And then there are pill forms that people will take after that to help keep that artery open. There are medicines to help lower the blood pressure. If the patient has too high a blood pressure, you're asking this poor injured horse to run faster, right? So we say, hey, let's quiet the horse down. And there are things that help lower the blood pressure, slow the heart rate down, do a number of things that help to allow the heart to heal. And by the way, a lot of these are things you take after the heart attack because they also help to prevent the next heart attack, which is public enemy number one.